As a hospital, we are having an oxygen generating plant that is ready, that actually has the ability to deliver oxygen at the rate of 300 liters per minute. And this oxygen plant is able to serve the whole hospital, having piped oxygen. There's a piped network throughout all the walls within the hospital that are withdrawing oxygen gas from this generating plant. And the plant also has the ability to refill oxygen cylinders of various sizes, and these cylinders are used as backup within the hospital, and also having the capacity to refill the same oxygen cylinders that are able to serve the sub-county facilities within the county, which are now gaining the oxygen supply from this hospital. Also, apart from this oxygen generating plant, there's a separate plant in serving ICU that is able to produce oxygen gas at a rate of 230 liters per minute. And this is solely dedicated to the intensive care unit to serve patients who are in critical care for the ventilators and all that. So we can say during this pandemic as a facility, we've been able to administer oxygen at the required levels because of the immense production from the hospital. In Kakamega, we can say we are oxygen secure because from the production itself, we are able to meet the demands as a facility, and also the sub-county facilities within the county also to meet that demand for oxygen from the patients that are coming in, both due to corona and also other clinical cases that require oxygen as a supplemental in terms of treatment. Yeah, as a county, we are able to support the sub-county facilities in terms of oxygen provision. We have an arrangement in such a way that the facilities are able to bring in their oxygen cylinders. We're able to refill the cylinders. Then they are taken back to the sub-county facilities at no cost. And that now makes oxygen provision right at the sub-county facilities. Oxygen is now available. So as a county, from this single oxygen plant, we're able to support all the facilities that need oxygen in the county.
Now we have two main centers. We have the Kakamega County General Hospital and Mumias in Mumias Sub-County, Mumias West Sub-County. Now at the main COVID center, which is where we are now, we have a total of 14 patients who are being treated. 3 are in the ICU and the others are just on normal treatment. Now out of the 3, 1 is out of danger and may be released from the ICU to the normal ward. Now, however, as we speak right now, in the casualty, there are 4 patients who are suspects, and I think they're just about to be admitted to the COVID center. I think their samples will be collected for verification, but they are showing all signs of COVID infection. Now, so far, we have 8 healthcare workers who have been infected with the virus. All of them are on home-based care, and they're doing fairly well. So sooner than later, they will be out of danger. And then we have 71 patients who are on home-based care also in total. Now they are also being monitored closely by our public health workers, and we hope they will also be out of danger, and when tested they will come out negative. So that is the situation as it is now. At Mumias, we have only 4 patients. Now these were ones, 2 of them were ones at the ICU, but through proper care they recovered and they are now at Mumias, which is just a stopover for them to exit the facility to their various homes. So far, although the cases that are turning positive appear very high in Kakamega, but most of them are asymptomatic. So they are not admission cases. Where we are right now at the CGH, assuming that these 4 who are at the casualty are going to be admitted, then we are talking about full capacity, because The other beds are ICU beds. So that means those who are out of danger but are here at the CGH are going to be discharged and transferred to Mumias on now their way home. But as of now, CGH is full to the capacity. Mumias only has 4, but Mumias has the potential or the capacity to hold up to 60. So we still have enough bed capacity for any eventuality. Now Kakamega County is very safe when it comes to oxygen supply or availability of oxygen, because even in the background, and I'm sure you can get even the noise or the sound that is being made by the machine, we are able to produce enough oxygen. The machine behind me has the capacity to produce 300 liters of oxygen per minute. Then there is another one which is reserved specifically for the current ICU, has the capacity of 230 liters per minute. So we are sufficient, and the machine behind me can refill oxygen cylinders for the level 4 hospitals in this county without any problem. Up to now, we have 2 county workers. One of them is a fairly senior officer, but is currently on home-based care. He's positive. And then another one again, who also tested positive. So far we only have 2 confirmed cases of the county workers, apart from the healthcare workers whom I've already alluded to.